Hello and good morning, and dear viewers, you're most welcome to the DAKTARI program, a health episode which airs here on West Nile TV every Thursday from the hour of 11 a.m. to noon, where we bring you people in the medical field to educate your viewers matters regarding health. Yet today we have another exciting topic for you, the viewers. We know it's a holiday or festivals period. This topic is quite adequate for, maybe appropriate for the young people outside there and also the adults. Because we have often seen young people playing with stuff, stuffing them in their ears, and they don't know it could result into some dangers, which our guest today will take us through. However, before we go into the topic that deep, let's first get our guest introduce himself, then pick on from there. Thank you.
Thank you very much, my host presenter for West Nile TV. I appreciate you people all as a team of West Nile TV for always hosting me here to discuss interesting topics with the people, to sensitize the people. I will mention it, but can't mention it now. I will mention it later. He has changed something very big somewhere. I'm seeing it as per now. Good morning, our dear viewers of West Nile TV all over the globe. I'm called Herbert. As he mentioned earlier, we're coming to do an interesting topic, and today I step as in the cadre of an audiologist. I hope as we go deep with the topic, you will understand what an audiologist. Thank you very much for hosting me here on West Nile TV.
All right. Thank you very much, Mr. Herbert, also for giving in your time to come and educate the viewers of West Nile TV. It's not something for granted, and always this program has impacted the viewers. We would love to understand from you. Our topic of discussion today is hearing loss. We have often seen people in the community, most attribute it to aging, like maybe when you become an adult, you lose your hearing capabilities. When maybe the children must have stuffing maybe beans into the ears. We would love to know from you, what's hearing loss itself?
Thank you very much, my host presenter, for bringing in that topic. Before you start in a topic, it's good you give a definition of a topic. When I went to understand hearing loss, I picked two sources, the American Deaf Society and Hearing Loss Association, together with the World Health Organization, define hearing loss as partial or total inability to hear sounds due to middle ear infections or aging or genetic factors or trauma causing damage to the eardrum. That is what they define hearing loss as. Yeah.
All right, thank you, Ms. Herbert. Then also would love to know from you, because you're talking about the ear. Because like I believe also the viewers, for us, when we talk about the ear, we just know this outside
Exactly.
part. Is the ear only this outside part we see, or the other structures which are in that system of hearing?
Thank you very much for bringing that topic. When I go outside there, when I just say your ear is paining, most people may think it's just the outside ear. Our dear viewers of West Nile TV, the ones who did some science, some did do it deep. Our ear is divided into three. We have the outer ear, which commonly you people know is called the pinna, or some people call it as the auricle. Inside there we have the middle ear. It contains what we call the eardrum, and there are some bones. There are three bones, one called molars, incus, and steps. That is what lies in the middle ear. I will have given you a picture, but I'm sorry I just forgot. You may forgive me, next time I will come with a picture. We have the inner ear. The inner ear contains what we call the eustachian tube, which also connects with when you look at the ear, nose, and throat, that's where also basically I perform some of my duties. There's a connection. The eustachian tube somehow connects to the throat. We have the auditory canal, which transmits sound nerves to the brain for interpretation. You have the cochlea. Those are the structures in the inner ear. So when they tell you the ear is divided into three structures. For a simple science, you say the outer ear, the middle ear, and the inner ear. So when you want to go deep with science, you say the outer ear contains the pinna, the middle ear contains the eardrum, the three bones of the ear, which some people call the ossicle, but each bone has its name. The first one is malleus, the second one is the incus, the third one is the steps. Those are the structures in the middle ear. When you go to the inner ear, you talk about the cochlea, the auditory nerve, the semicircular canal is still in the middle ear. You talk about the eustachian tube. Those are the inner ear structure. So basically, a brief anatomy or science of the ear is that.
All right. Thank you very much, Mr. Herbert. Indeed, you have gotten a feel of what the ear looks like. You have cleared the air that it's not only this outer part we see. Then also, since you have taken us through the structures of the ear, we would love to know from you, are there some types of hearing loss which could be there?
There are types of hearing loss. True. When the American Deaf and Hearing Loss Association, together with the World Health Organization, said 400 million people suffer from hearing loss problems, out of which 17% can access assistive hearing devices. So when they gave types of hearing loss, they said one was called conductive hearing loss. The second one is sensor-oral hearing loss, and then the third one was mixed hearing loss. When you look at conductive hearing loss mostly occurs due to middle ear infections. Infections are the one which cause conductive hearing loss or wax buildup. Our dear viewers who may not understand wax, whenever you're cleaning your ear, that brown thing or that sometimes black, you always clean using an ear cleaner or an ear pad, that is a wax. So those are the causes of conductive hearing loss. When you look at what they call the sensor-oral hearing loss, they say mostly it is caused by damage to the eardrum, which can be due to loud noises. I will give you an example of the headsets we use, the earphones we use with increased volume. That is what they call the sensor-oral hearing loss. Then when they went to the third definition to tell the community what a mixed hearing loss, they said when two signs from the conductive hearing loss combined with the sensor-oral signs, they give the mixed. Meaning, when they say you are having a mixed hearing loss, you may have signs of mixed middle ear infections or wax buildup, or you may have a damage to your eardrum, which can be due to loud noises. That's what causes a mixed hearing loss. Thank you. Those are the types of hearing losses.
All right. Thank you very much, Mr. Herbert. You have taken us through this hearing loss, and you have tried to show us as if each of these types of maybe causes is targeting a particular part of the ear. Exactly. Where the conductive said it's targeting the middle ear. The sensor-oral is targeting the eardrum. Then also the mixed
targets the both.
We would also love to know from you, though you have taken us through some of the causes which could bring about a hearing loss, we would love to know, are there other factors or maybe things that the viewers could be doing which could also predispose them to a hearing loss?
Thank you very much, our dear viewers of West Nile TV. In a week, out of 5 people I always meet or attend, 3 complaining of ear problem. 3 people out of 5 complaining of ear problem. Our common problem is the ear wax. When the wax build up, you always have problems. They complain of their ear aching. So basically, the first cause of hearing loss or people complaining of their ear is the wax. Secondly, some people get problems with hearing loss due to trauma. Mostly when you see accident happen, Some people bleed through the ear, of which you are not sure if their eardrum is damaged. That's why you have to check. So another cause of hearing loss can be increased volumes, prolonged use of uh, uh, devices with increased volume can cause a hearing loss. Untreated middle ear infections, your ear is discharging pus, which is called otitis media. You are not bothered to treat it, can cause for you a hearing loss. Foreign bodies can cause a hearing loss. There's a common culture with us, even me personally, I do. When I'm working, when my ear starts itching, when I don't have something to clean, I remove the lid of my pen for cleaning. So you can damage your eardrum from there. It's a common thing with us. So basically, those are the common causes of damage to our ear, which can cause a hearing loss. I will give you people.
All right. Thank you very much, Ms. Herbert. Actually, also it's the same concern I wanted to bring up.
Yeah.
We have seen people in the community when they get dirty ears.
Yeah.
Should I call them this?
Exactly. Some people just break some sticks.
Yeah.
They
Clean
continue.
the ears.
Yeah.
You have told us it's not advisable. Then also we have seen children put maybe, let me say, beans in the ears.
Exactly.
Okay, let me say, how can a mother in the community get to identify that maybe the child has put something in the ear, in the ears?
Thank you very much for bringing that. When you look at children, mostly the children have encountered with foreign bodies. Children are very sharp. Whenever they fix a foreign body in a place which makes them feel uncomfortable, definitely they cry or they report to their mothers immediately. And that's how mostly it is identified that children have got a foreign body in their orifices or any part of the body. Yeah.
All right, thank you. Then also we would love to know from you, how can someone in the community, it be the child, that young who is watching us outside there, or maybe the adult, get to know that they are having a hearing loss disorder?
Thank you very much. Our dear viewers of West Nile TV, one of the signs and symptoms of a hearing loss is difficulty in hearing a speech. Maybe you are listening to your radio, you're watching your TV, you can't listen to what is being said, you always increase the volume. That is one of the ways of identifying you're having a hearing loss. Secondly, sometimes you feel your ears are blocked. It happens with me every morning. When I shower, for like when I'm walking, I feel my ears are blocked. So those are the ways you can identify that you have a problem with hearing loss. Sometimes you feel ringing in your ear. Those are the common signs of hearing loss. You can identify from a person having a hearing loss.
Right.
Yeah.
Okay, thank you, Ms. Herbert. Then also would love to know from you, in case we assume maybe the child put a foreign body in the ears, which home remedies could these viewers do in order to safeguard their lives and also the children?
Thank you very much for bringing that topic. What I've observed from the foreign bodies I've encountered in children, when a child gets a foreign body, people always attempt to remove it. Our dear viewers of West Nile TV, parents out there, whenever your children get foreign bodies, leave that foreign body in place. Sometimes you attempt to remove it, you fix it deep. Please just leave the foreign body in place. Avoid panic. Bring these children to hospital. Because I don't advise you people to attempt to remove this foreign body. Trust me, some of those foreign bodies in the nose, in the ears, they have special instruments for removing. So you may attempt using your fork. Those are the common things people attempt using. Fork, a sewing needle. Those are the things people attempt to remove these things with. So you keep pushing this thing deep. When a child gets a foreign body in the ear, that's not your work. Please help this child, just bring to the hospital. it will be removed from there.
Alright.
Yeah.
Then also there is some habit in the community
Yeah.
where people get maybe, let me say, warm water,
Yeah.
and they try to pour it in the ear. Some use, let me say, cooking oil
Exactly.
to cleanse the ears. Is that habit advisable?
Thank you very much. When you look at the habit of using warm water, I know indirectly there's what we call ear rinsing or ear irrigation, of which these people are trying to do. Our dear viewers of West Nile TV, how sure are you the warm water you're using is in the required temperature for doing an ear irrigation? What if you burn your child or your eardrum in attempt to do an ear irrigation? Secondly, when some people, I used to hear it when I was a child, when an insect enters your ear, you have to put a cooking oil there. The insect will get stuck, it will not move anywhere. How sure are you? This cooking oil, do you know what it contains? What it goes there and blocks your eardrum forever. So me, I don't advise people doing ear rinsing with warm water, cooking oil from home. Leave those things, come to the hospital. We know doing an ear rinse, the temperature of water is supposed to be this. We have the ear rinses we can use for flushing. So I don't advise people using cooking oil and doing ear rinsing or ear irrigations at home using warm water. The water may be too hot, it may burn your eardrum. So me, I don't advise. So our dear listeners of West Nile TV, please and please change from today. Come to the hospital, see an audiologist.
Okay.
Thank you.
Thank you very much, Ms. Herbert. I hope the viewers have taken keynote. Please, these interventions you shouldn't do at home. Instead, go see the audiologist who will help you work out the challenges you have with your ears. I also would love to get to know from you, in case someone in the community has had some of the symptoms you said, they can't hear very well, they try to raise the volumes high in order to get to pick very well. We would love to know, whenever they come to the hospital, what do you always do to confirm maybe this person is having a hearing loss disorder?
Thank you very much for bringing that question. I know many people, as I'm going to speak, they are very keen to understand what is being done. When someone has the signs and symptoms of a hearing loss, the first test you can do is a physical examination. Under a physical examination, I can get my thoughts. I tell you to lie down flat. I pull your pinna or your outer ear a bit. I flash my thoughts there. I see if there's wax. So, apart from the wax, there's what we call a whispering test, of which you doctor or your healthcare service provider will move 60 centimeters away from you and whisper a word and tell you if you have got what he's saying. It's called a whispering test. There's what we call a ticking words test. Most of you have seen these watches which stick. When you buy your wristwatch which sticks, when you even put it in your ear, you hear it ticking. So your doctor or your healthcare service provider may give you that watch, will tell you, put in your ear. Are you hearing it ticking? If you tell him no or yes, those are the tests we give to check for a hearing loss.
Okay.
Yeah.
Alright, then also would love to know from you, in case maybe a patient, let me say maybe client visits the hospital, how do you guys always see, because I've seen people and the community have compacted wax, like they can't hear very well, but it's attributed to wax. How do you always guys like see through the ear to identify whether this person has that much wax?
You know very well, we have very many types of machines. When these people come to the hospital, mostly we use the pen torch. There's a torch which looks like a pen. You flash in this person is here. We have headlamps. We are with a very strong lens. We pull that person's ear bit. It goes directly to the eardrum. You see what is there clearly. So once you get a lot of works, that's when you request for an ear irrigation, or what they call ear rinsing, using lukewarm water, not warm water or hot water. Hope you are now getting my words. Lukewarm water. It's not hot, it's not too warm, it's just in the middle. So I was telling you people, don't do it at home. You may use hot water which may burn your eardrum. That's what we do for them.
All right. Thank you very much, Ms. Herbert. We are going to first get off break for a commercial break. Then in the next segment, Ms. Herbert will take us through how they always remove that excess wax you could be having in your ears, and also how they always remove these foreign bodies in case you have your child having stuff, maybe like beans in the ear system. Let's get back.
West Nile TV, lighting up the region.
Unwrap your holiday cheers with StarTimes this Christmas season. Starting the 15th of November, simply pay your monthly subscription for the next bouquet and automatically enjoy content on the next higher bouquet, plus a chance to win exciting prizes. Your gift box contains variety of local entertainment and fresh shows, exciting cartoon and fun kids entertainment, mega superstars, local and international, a memorable trip to Spain to watch a La Liga match. And that's not all. Lots of prizes to be won, including ZTE Nubia smartphones with free 15 GB Airtel data. StarTimes gift that keeps on giving. Merry Christmas. This message is powered by ZTE Nubia. Better for all.
Chichi? Go wangula. Nsasula emyezi 3 nempangula. Hey! Ha!
Abayo, ubatachi.
Subscribe for 3 months to any package of your choice or grab an Azam TV kit and pay for 3 months and stand a chance to win life-changing rewards. Android smart TVs, fridges, motorcycles, and that is not all. You could walk away with free subscription or the grand prize of 20 million Ugandan shillings in cash. Yes, 20 million grand prize. Subscribe today and enter the draw. For more information, 031-2308-900 or visit any Azam TV dealer near you.
Azam TV, entertainment for everybody.
West Nile TV, lighting up the region.
We'll be back, dear viewers, from that short commercial breather. It's still the DAKTARI program, a educative show which airs on Western TV every Thursday from 11 to noon, and I'm always your host, Sunday Junior Tom. Today, we're delighted to be joined with Mr. Herbert, who's taking us through a topic regarding your ear system, which we call the hearing loss disorder, because often we have seen kids are back from schools to homes to celebrate maybe this festival season. Always these kids pick stuff like pins and put into the ears. Then he's here to help us, guide us on how we can do that. Then also would love to know from you, Mr. Herbert, what are some of the, often some diseases lead to disorders. Could there be other diseases which could predispose a viewer to get hearing loss itself?
Thank you very much for bringing that. It's true, some diseases also lead to hearing loss. There's a disease called Mendel's disease. This disease commonly affects the middle ear. Once it affects balance, it leads to hearing loss. It's called Mendel's disease. There's what we call acoustic neuroma. It's a cancer or a tumor which grows in the auditory canal. So once this tumor, I'm sorry, our dear viewers, when I say a tumor, it's like a cancer. So don't get afraid. There's a cancer, it is called acoustic neuroma. It grows in the auditory canal. So once it grows there, it can affect your hearing loss. There's a disease called labyrinthitis. It mostly affects also the inner ear with the middle ear. It affects, once it grows there, it affects our hearing. It causes a hearing loss. There's what we call osteootosclerosis. When the bones, the bones in the middle ear, the three bones of the ear, the ossicles, the malleus, the incus, and the stapes, when they don't align properly, it affects our ear. It also causes hearing loss, affecting balance and other things. So basically, those are the common diseases which affect hearing loss, which cause hearing loss.
Okay, yeah, thank you, Mr. Herbert. Then also would love to know from you, which interventions do you always do for patients who come to the hospitals these hearing disorders? Some could be maybe as a result of this much wax in the ear. Some maybe could be, let me say, aging or other related factors. How do you always intervene for these patients?
Thank you very much for bringing that good question. Management is key following a disease outbreak or disease onset. When you look at patients who come with hearing loss can be age related. It can be due to trauma. It can. When I talk about trauma, when accidents happen, when someone bleeds through ear, there's what we call a hemotympanium. Hemotympanium meaning blood in the eardrum. The eardrum may be ruptured, so it can cause a hearing loss. So there are very many causes. It can be due to middle ear infections. So when someone comes with a complaint of the ear, when we inspect your ear, when we discover the problem is due to middle ear infections, we give you antibiotics with some ear drops. Definitely they will clear you off. So when we also discover your problem is AIDS related, as AIDS goes, the systems in our body also degenerate. So we give these people assistive hearing devices. There are some common things you always see some people fixing in their ear. So those assistive hearing devices are commonly, when we inspect your ear, when your problem is due to earwax, there's ear syringing, where we make you to sit upright. Once you sit upright, we get our warm water. It is called distilled water, sterile water. It is germ-free, warm. We get a syringe. We remove water in it. we pull your ear out a bit, your outer ear, which people call the pinna. We flush that water inside, and then we tell you to bend your head in what we call a receiver. Definitely that water will melt the wax, it will flow out. We keep repeating until the water from there flows clean, meaning your ear is very clean. We get an ear pad, which commonly people call an ear cleaner. We clean. We also send you back home on some antibiotics because the wax has tendency of causing infections. So once your problem related to the ear is due to trauma, the ear also can undergo surgeries. So there are specialized hospitals. Our standard doesn't do surgeries of the ear. We refer you for those surgeries. You have to go and get them. So if your problem causing the hearing loss is due to foreign bodies, either your child has fixed a seed in the ear, whatever, we have instruments. The instruments are set according to the type or the shape of the foreign body the child has fixed there. We fix it, we hold the foreign body, we bring it out gently, and your child becomes okay. So that's why I was telling you, once your child gets a foreign body in the ear out at home there, don't panic. Never attempt to remove it. You may push it inside because you don't have the instruments which are set to remove it. So just bring the child to the hospital. Don't panic. Everything will be okay. Thank you very much. That's the management.
All right. Yeah. Thank you very much, Mr. Herbert. I hope the viewers have gotten some of the bit they always do in the hospital. In case you are aging, they will give you the hearing aid.
Yeah.
Then for the kids, in case there are beans, please, parents don't try to remove, because instead you push it further, yet they can pull it out with ease. Then also would love you to give some package to the viewers, or especially maybe someone who is maybe transitioning aging. How can they take good care of their ears to safeguard themselves from getting hearing disorders?
Thank you very much. Our dear viewers of West Nile TV, once we age, the systems in our body, they degenerate, they become weak and weak. So one of the best ways to take care of your ear as you age, you have to seek for medical attention in case you're not feeling fine. Never ignore symptoms. That is the first thing I will tell you. Maintain a healthy lifestyle. One of the ways of maintaining a healthy lifestyle, I know there's something common with us. Whenever we're using earphones, headsets, we like increasing the volume. So you have to sense from that. You have to desist from that. Systems in our body, they need good food. Maintain your diet regularly. Change diet. Those are the things which also build the body. So in case you're not feeling fine, you have to see an audiologist for further consultation regarding your ear. It will be the best option for you as you age. You may age until you even don't use an assistive hearing devices. Your ear will be strong as you were born or as you grew up. Basically, that's what I will tell the people aging.
Okay. Yeah. They also would love to know from you, what things can the viewers do to prevent exposing themselves to getting this hearing disorder?
Thank you very much. As I said earlier on, one of the good things you should do is maintaining a healthy lifestyle. One of maintaining a healthy lifestyle, cleaning your ear regularly. Cleaning your ear, as I told you earlier on, you should use clean instruments or materials, not dirty ones. Where you go, you pluck a grass, you start cleaning your ear. You don't know what to move over this grass at night or during the day, so it's not a good habit. Whenever you're not feeling fine, never ignore symptoms. Visit your audiologist. Okay. When you're using earphones, headsets, never increase the volume. Even your phone gives you a warning whenever you're increasing the volume. Increasing volume increasing a high volume stands the risk of damaging your ear. Sometimes they give you a warning there, cancel or you accept. Some people just cancel and you increase. So those are the things as young people you can do to maintain a healthy ear.
Okay. Then also would love to know from you, in case maybe someone outside there is reluctant in regards to health of their ear, which complications can they get in case maybe they happen to get maybe a disorder with the ears?
Commonly, you can get a permanent deafness. Permanent. When I say deaf, you people now understand total hearing loss, where you don't hear anything. That is the commonest you will get. Though other things will come in, but permanent deafness, you know, when you don't hear, you start now using a sign language. So that is what you will get.
Okay. Yeah. All right. Then, by the way, would love to know from you, what's the difference between hearing loss and deafness?
As I told you on, when you look at hearing loss, it's partial or total loss of sound transmission to the ear, which can be due to genetic, trauma, or middle ear infections. But when you look at deafness, deafness or total hearing loss, where you don't hear due to damage to the nerves in an organ called organ of Coti, which lies in the auditory canal, which transmits nerve impulses to the brain for transmission. That is what we call deafness. Total hearing loss, where you don't hear anything because of damage to the nerves in the organ of Coti, which lies in the auditory canal, which transmits nerves to the brain.
By the way, we'd love to know from you, I had this of hereditary. Can hearing loss be passed on from one generation to another?
As I said, it can be genetic. When I say genetic, meaning it may be there in your family history. Maybe my grandfather had a hearing loss. As years went on, I was born, I'm also getting a hearing loss. So that is something which was genetic. I've just inherited it to myself from there. It happens.
Okay.
Yeah.
All right. Thank you, Ms. Herbert. Hope the viewers are getting educated on these matters regarding your ear health. Then also would love to get some clarification from you.
Yeah.
Children outside, they're always like playing.
Yeah.
Some like throwing sticks to each other.
Mm.
How can they always protect their ears from getting that thrown?
Thank you very much for bringing that topic. Me, I like children whenever I get them doing rough activities. So when I get them doing their rough activities, I tell them the dangers of that activity with live examples. So children, you know, they fear getting also injured. So once you tell them what you people are doing will lead you to this, because of fear, definitely they will change. I've ever talked to many whenever I get them doing very rough activities. Parents out there, it's holiday time. When children are doing those rough activities, talk to them openly about the dangers. Definitely they will change their fear, also getting injured. Thank you very much.
Okay, thank you too, Mr. Herbert. By the way, often we have seen also people in the community. This takes us back on the symptoms someone can present with.
Yeah.
We could be like having a conversation, me and you.
Exactly.
But someone all the time is saying, please repeat, pardon, pardon. Could also that be a sign that this person is having a hearing loss disorder?
Thank you very much for bringing that. I missed it. It's one of the signs and symptoms of a hearing loss, as you've just mentioned it. Someone wants speeches repeated, however close you to the person. So that is one of the signs and symptoms of a hearing loss. I just missed it.
Okay.
Yeah.
Yeah, then also we have seen people in the community take certain drugs and they say maybe when I started taking these drugs, my hearing capability is reduced. Could that be scientifically true, or maybe it's just side effects of some of these drugs people take?
I will give you an example of an accidental injection of IV quinine using for treating malaria. Instead of being diluted, it was given direct. Up to now, that person has a permanent hearing loss. So it's true, some medications cause a hearing loss. Example I will give you is the quinine using for treating malaria. It causes, and sometimes when it is given to people, someone will tell you there's ringing in my ear, something is ringing in my ear. So prolonged use sometimes damages some people's ear. It causes.
Then also we would love you to give in some guidance to the viewers. You know, we love, let me say I'm talking to the young adults outside and the youth. They love music.
Yeah.
And it's like, when music is not loud, it's not music.
Exactly.
So how could you guide them out to how to enjoy their lives, but also protect their ears?
Thank you very much for bringing that topic. I will still stick to my point. Most of the young people out there, when music is not in high volume, that is not music. I mentioned to you people early, whenever you're using your phones, using your headsets or earphones, whenever you're increasing your volume, your phone always gives you a warning. Increasing volumes high for a long period damages your eardrum. So it gives you an option, cancel or okay. When you put okay, meaning you accept to increase the volume. Please, the phone is giving you the right information. Follow, never increase the volume. So when you go to your dance halls, I will also advise the dance hall managers to put sound absorbers. Once those sound absorbers are there, the music will not be all that damaging, giving that vibration direct to the ear. And I know we love leisure, but let's also not stay in those places for long, because that vibration from the music, sometimes you feel it up to your heart also there beating, and also your eardrum. Those things cause hearing loss after a long time. So those are the things I will advise them to reduce on.
Okay. Also would love you to explain, maybe make it clear to the viewers. We have seen maybe some disorders could be reversible, some are irreversible. In case someone gets this hearing loss disorder, can it be reversed back and this person gets to hear very well, or it can't be reversed?
Thank you very much. Most of these hearing disorders are reversed. They are reversed in a way that when you get an assistive hearing device for this person, the person will be able to get his or her hearing back. But as earlier on I told you, the World Health Organization said 400 million people suffer from hearing loss, out of which 17% only get assistive hearing devices. Meaning once our people get hearing loss, we just take it as something which has happened, we neglect them. So the longer you also neglect, the more it continues up to this person goes deaf. Yeah, I've seen most of these hearing devices are reversible, because I've seen people whose eardrums have ruptured. They have gone to see the audiologist, they are given assistive hearing devices, they are now putting on it, they are very okay. I have a teacher who got an accident, he was bleeding through both ears. So from that time, he's given both assistive devices, left and right ear. He teaches very well, hears very well, even talks. He's very okay. So it is only negligence sometimes which makes us think these things are not reversible, and we don't go for consultations. Yeah.
Thank you very much, Ms. Herbert. In this regard, I'd love you to give some package for the viewers as almost coming to the closure of the program.
Thank you very much. I appreciate West Nile TV for bringing me here for this interesting discussion about hearing loss. I've given you a lot. Allow me thank the viewers of West Nile TV. When we clocked the festive season, that was from 1st December up to now, today is 11. Trust me, we have never seen any accident. We have never seen any accident. Meaning the community is sensitized now. They know how to use their roads, they know how to do everything now. We have never seen. So, thank you very much for following that. One thing I want to put forward for you is whenever you're not feeling fine, any symptom, we have various services you can access when your ear is not okay. Consult the audiologist. Never hide symptoms, never ignore them, give them openly. That is what I can tell them now. Thank you very much.
Thank you to Mr. Herbert and also to the viewers, esteemed viewers of Personal TV who are with us from the start of the program up to the end of the program. We don't take it for granted. You giving in your time to get also educated on matters regarding your health. I've been your host, Sunday Junior Tom, together with Sophie behind the camera. Till next Thursday. Have a nice time.